Hello and welcome to the Every Ancillary podcast. I'm your host, Michael Berg, joined as always by Viv Hudson. And Viv, a very special guest, a return guest, is joining us today.
Yes, and I'd like to welcome Daniel Medrano. Daniel has been working with us for quite some time now, and he is joining us from New Mexico. So, welcome to the program, Daniel.
Thank you guys for having me.
So, Daniel, I am glad you got on today because you know a lot about this market with diabetic neuropathy, but also how the DND device dovetails with some of the other diagnostic equipment that's out there. And of course, we have a Section 179 special going on now for the rest of the year, which incorporates the diabetic neuropathy device, along with our TM Flow, which is an autonomic nervous system testing device with ABI. But I know you've been working on some other options for doctors because basically we're with that option, which is a great option. The cost of it can be prohibitive sometimes for physicians. So I know you and Vivian have been working on filling that niche there of maybe something that's in between the DND, but not quite the DND plus the TM flow. So we wanted to get you on to discuss that a little bit.
Yeah, absolutely. I appreciate that. And you're correct. I think a lot of the providers, we try to capture the reimbursement aspect to justify the cost of an expensive piece of equipment and then run the return on investment based off of how many patients it takes from their payer mix before they actually break even and start generating revenue. And I think what we have come up with, both Vivian and I, is really looking at the diabetic neuropathy device, which can capture reimbursement as low as $65 to about $135. It's a little somewhat complicated how you capture that reimbursement. That's just special thanks to Medicare for putting those little obstacles ahead of us. But what's unique is that the diabetic neuropathy device, of course, detects peripheral neuropathy, but most providers are always confused and they need some type of validation to, number one, confirm that it is neuropathy, or there's an idiopathic condition that they believe may be some type of claudication. Those are the two most difficult yet very similar conditions within a patient who, let's say, has diabetes. And they are treated completely differently. So what we've come up with is actually offering a package that allows the DND to be used in combination with an ankle brachial index or an ABI for all peripheral arterial disease tests.
So, how are doctors actually diagnosing or looking at this now? Are they using some rudimentary tools in their practice or are they having to refer out?
You know, that's a great question, especially if we're talking about primary care providers. A lot of them may still use the monofilaments and or tuning forks, right? And sometimes they're just using an IP switch or a questionnaire asking the patients, do your feet hurt? A lot of the providers, if you've been in a clinic, you realize sometimes they don't even take the patient's shoes off because a lot of the patients sometimes just don't wash their feet, and that's a reality. So the idea is they ask the patient, do your feet hurt? Are you seeing anything? And sometimes it's just a yes or no. So unless there's somebody who's a specialist like a podiatrist who's actually requiring to see the patient's feet, not all patients have their shoes off. But based off of the patient's responses, they're trying to determine that level of, okay, if it's painful, maybe I need to have you take your socks and shoes off, and then we'll review that. Again, every clinic has different protocols, but that's the point, is now we have a more comprehensive approach where if the patient does take their shoes off, the DND is ideal and can rule the fact that it's not claudication. And with the new Bluetooth ABI that we have, they don't necessarily even have to take their socks or shoes off. As long as we can reach the ankle, that measurement can be graded as well.
And I think one of the great things about these tests is how quick they are. So, what's been your experience with physicians and using this equipment? Like, how receptive are they to it?
I think the greatest acceptance comes in when the providers can bill under their E&M code, right? When the patient comes in, whether it's an existing patient and they already have some form of condition that justifies the need for this. Billing it under that same patient visit with any other types of procedures that may be done in the clinic greatest success, but most importantly, the fact that it's reimbursable by almost every payer. And when I say almost, there are a few across the country that we've come across. I think Blue Cross, Medicare requires some prior authorization. It doesn't mean they don't pay for it, but they just put walls up. But if they get that authorization, it is reimbursable anywhere from, again, the Medicare fee schedule for us throughout the Southwest with Novitas is about $85. And we've already gotten the new fee schedule for 2019, and it went down just, I think, about $1.50. But that's now, we're talking almost 10 years with this CPT code that is very strong. So evidence-based, absolutely. The strong reimbursement history, absolutely. And again, to your point, we're talking about once the patient is already on a treatment table, they're just supine facing up, right? And getting the test is probably no more than maybe a minute once they're positioned. So that starts from when the patient's roomed, right, to when the patient's ready. And the test in and of itself is less than a minute.
And I think that that's one of the really attractive things about these devices is how quick they are for a start, and plus they have a reimbursement. So let's talk about the reimbursement a little bit now, and how frequently can they bill for these devices? Because that'll be another key question that reps want to know and doctors want to know.
Yeah, I think that's probably one of the most vital questions, right? When we're talking about different pieces of technology, a lot of the times it's only once per year or twice per year. However, when we're looking at this, which is actually a 93, the code 93922 is a vascular code. And the importance behind that is it can be billed up to 4 times per year. What that means is after the 90 days, you can do that again. And the basis behind this is that a lot of the patients who have, let's say, a heart condition, diabetes, history of smoking, 65 and older, I mean, all the really simple basic criteria, even hypertension for commercial plans can and should be tested for this, because when a patient is undergoing any type of medication management, some of those meds can compromise the patient's liver. And historically, there have been some medications on the market, some SGLT2 meds that have compromised the patient's lower extremities to the point that their feet and legs needed to be amputated. And if nobody's really checking on that, and sometimes primary care providers don't necessarily see the patients as regularly, they might see them twice a year, maybe once a year. A lot can happen within 3 months that compromises their lower extremity where they have an amputation, or worse yet, they simply have a cardiovascular event and it's done. And that's the point and purpose of establishing a baseline the first time. After those 90 days, checking to see how that medication management is working for the patient. Hopefully, it's not compromising anything. And then the providers can also determine if there are other treatment methods that they want to apply to continue to improve that. So, usually, if there's any type of abnormality from that baseline, that justifies additional assessments. But even after that, anything can happen within different medications or the patient's lifestyle. So it's important to stay on top of that. And again, that's the reason you can bill that up to 4 times per year.
Right, and that's got to be a good benefit to physicians, knowing that they can run this test in 3 minutes or less
Right.
and get a reimbursement on it.
You got 30 to 60 seconds with the doctor. How do you get the conversation going?
A lot of it is just asking what they do for their patient's lower extremity. And if we had something of value to show them to address lower extremity idiopathic conditions, I'd like to present them with the two options, one for neuropathy and one for claudication, which at this point in time are both objective pieces of medical devices and have a solid reimbursement. One are reimbursing 80 on average, about $85, and the other one going as high as about 135 when they bill that appropriately. So usually, depending on the provider, we always try to make our best efforts. If we know somebody already does ancillaries, they're going to listen to us. If it's a cold call and somebody who doesn't really do many ancillaries, they're usually probably going to start looking at the potential for the reimbursement. That's if they even want to take that into consideration. But that's the short answer, is just presenting, we have a solution for lower extremity. Can we show you a flyer?
I like it because, yeah, you mentioned they are deep down, I think that they are driven by the reimbursement in so much as it has to make financial sense in order for them to do something. But I think sometimes doctors feel dirty about doing something just for the reimbursement. But what's great about this is that, yeah, does it make financial sense? Yes. But this is also giving you clear, objective data that you wouldn't normally be able to ascertain using these antiquated methods. And this is what we're going to be able to do. Put this power in your hands so that you can get better patient outcomes. That's what it's about.
Correct.
Vivian, how do they get started?
Just go to everyancillary.com, look for the diabetic diagnostic toolkit and add that to your bag, and we'll get you set up with everything that you need, as well as connection to Daniel to be able to help you with any sales support, as well as myself. I do have one more
announcement, Viv. I forgot to bring this up, but we do have the videos. Don't forget, we just made a promo video. We have not done one yet for the diagnostic toolkit, but I am going to build that. But for all of you premium members for the Every Ancillary website, by the time this is posted, you should be able to go onto your diabetic neuropathy page on your affiliate website, and there is a promo video there that is less than 3 minutes long. Perfect thing to show a doctor to get them interested.
Great. Thanks, Daniel.
Yes, you're welcome. Thank you both for your time again.